I'm talking today to clinical psychologist Dr. Lisa Orban. Hi, Lisa. How are you?
I'm well, Joanne. How are you?
Very well, thank you. Lisa, we're going to talk today about cognitive behavior therapy, or CBT. What is CBT?
Well, CBT is one of the most widely used and well-known psychological therapies out there. It can be used for children, adolescents, adults across a broad spectrum of emotional and behavioral difficulties. It's an evidence-based approach, which simply means that there's a large body of research out there to show that it's effective for a wide variety of issues. In fact, CBT is one of the most researched psychological therapies out there. Basically, CBT helps us to look at the different thinking styles and behaviors that keep us stuck in our problems. So we then learn to identify them and establish different, healthier ways of relating to the situation. CBT is very solutions-focused. It's all about the present, forward movement, and productivity.
What is the theory behind CBT, or the ABC model of CBT?
Well, CBT works on the premise that the way we feel in a given situation is largely determined by how we think about it. So we look at a person's cognitions, which would be the C in CBT. We also look at the B, which is one's behaviors. And sometimes you need to behave differently in order to feel differently. So this may involve assertiveness training or facing a difficult situation that you've been avoiding. This involves practicing a different and more helpful way of behaving. The ABC model, which you asked about, is the way we dissect a problem in CBT. So the A is the activating event or the trigger for our pattern of thinking, and the B is our belief that we have about the activating event. The C is the consequence. For example, we could feel quite depressed or angry or anxious. So this is the model that we use, the ABC model, to better understand the cognitive processes behind our feelings.
And can you give me an example of where CBT would be an ideal form of treatment for somebody?
Okay. Well, again, CBT has a strong evidence base to show that it can work across a broad spectrum of disorders, including depression, OCD, anxiety, phobias, anger, chronic pain, amongst others. It's a very goal-directed therapy, so it would be ideally suited for someone who is committed and motivated to engage in therapy and invest in the work. It might not be ideally suited for someone who might be looking to explore the past in great detail or analyze their childhood, for example. The past, of course, is very important, but we just don't spend a lot of time back there with CBT. If we take a specific example, let's take the case of someone who's experiencing anxiety and underconfidence surrounding work issues. So, for example, they may, if we look at the activating event, perhaps they messed up during an interview. They said something that was wrong, or they fumbled over their words. So we would then identify the B, which would include the different problematic beliefs or thinking styles that they had about this event, about the situation. So, these thoughts are so quick that they're called automatic thoughts. And sometimes they can be very, very difficult to identify. So for this example, this particular person might fall into the trap of something called black and white thinking. Oh, that was totally awful. Or I'm a completely rubbish lawyer, for example, because I made one mistake or I fumbled over my words. Or they might just focus in on the negative of the situation and disregard all of the positive parts. That's called mental filtering. Maybe they have really high, rigid demands that they place on themselves. For example, I should have done that perfectly, or I must do it this way. And again, that can create a lot of anxiety in us. Perhaps they could have catastrophized. Oh, this is the worst thing that could have ever happened to me. It's dreadful. I can't stand it. So we would take a look at those different core beliefs, and then we'd start to challenge them. And we do this in a few different ways. One way would be to collect evidence for or against that type of thinking. Another way might be to reveal the logic behind that type of belief, and we do that through different forms of disputation. So instead of feeling really depressed or anxious, perhaps they would feel a bit more at ease and have a new emotional consequence, such as disappointment or, a bit of frustration perhaps, but it wouldn't be as pronounced as what they were feeling before. So So it's a more healthy negative emotion as opposed to an unhealthy negative emotion like depression or anxiety.
So CBT is not a quick fix. You definitely have to be committed. The therapy is ongoing.
That's right. It's a very active and directive therapy, and the therapist will prompt you in session by asking questions, by making observations, and it's a very collaborative approach. So the client is very much involved in all aspects of their treatment. The first session would involve you and your therapist discussing the presenting problem in detail and setting goals and a direction, and then each follow-up session would be building towards those goals. So again, you and your therapist would identify these different problematic thinking styles and behaviors and then practice more helpful ways of thinking and behaving in different situations.
Thank you, Lisa. Thank you so much for talking to me today.
You're very welcome, Joanne. Thank you.